the third session of Tech Web Series 3, organized by Department of Civil Engineering of KPR IIT. I would like to extend my warm welcome to Dr. Ragunathan, Center for Bio Research and Nano Research. He is the director of this center. He would like to present on the topic post-COVID of precautions in construction. Organized now, I request Dr. Kanmani to give a brief intro about our guest. I would like to extend my warm welcome to Dr. Ragunathan, Center for Bio Research and Nano Research. He is the director of this center. He would
Thank
like
you,
to
ma'am.
present on the topic
Good morning to all
post-COVID
present
of
here.
precautions in construction. Organized now, I request Dr. Kanmani to give a brief intro about our guest. I would like
It's
to
a
extend my warm
pleasure to
welcome
invite
to Dr.
and welcome
Ragunathan,
Dr. R.
Center for
Ragunathan
Bio
sir for
Research
today's
and Nano
session.
Research. He is the director
Dr.
of
R.
this center.
Ragunathan, he
He
is a
would like to
director cum
present
research
on the topic
supervisor in the Center for
post-COVID
Bioscience and
precautions in
Nanoscience Research, Coimbatore. He accomplished two postdoctoral fellowships, one in South Korea and one in Maldives. He holds PhD in biotechnology from Bharatiyar University, Coimbatore in 2005. Earlier, he worked as a principal in Maharaja Arts and Science College, Avinashi, Coimbatore. He has 27 years of experience in teaching and research. He published more than 90 research articles in reputed journals. Under his guidance, four of them completed their PhD degree and six of pursuing. He guided more than 600 PG projects in his research center. He received national and international award from International Publishing House, New Delhi, and Medicine and Healthcare, USA. He completed two funded projects for a worth of 35 lakhs. He has delivered around 70 guest lectures so far. He is an editor and reviewer in many reputed journals. Also, he is acting as a member board of studies in various reputed institutions. Sir, we welcome you for today's session on post-COVID-19 precautions in constructions. So, so before starting the session, I request the participants to show the presentation. You can view the presentation Thank you, sir.
This is the first time I am presenting this type of seminar. And that is, we can say it's a webinar. So again, sorry for the interruption. So first of all, I thank this Department of Civil Engineering of KPR Engineering College, HOD, and all the faculty members to giving me this small opportunity to share some views about this post-COVID. So before that, you must know about what is COVID. Since you are all already in lockdown, and you know about that, you suppose switch on the TV, all the channels throughout the Indian channels or foreign channels, whatever channels you would like to see, every people are discussing about this coronavirus infection, COVID, corona. So what is coronavirus? So when it was started? So I tell you about this brief introduction about this COVID virus. So COVID means nothing but coronavirus disease. Since it was emerged in 19, it is called COVID-19. That COVID-19 is abbreviated form for this coronavirus. Okay, it is a larger family of the virus. So actually, it is a small virus that is made up of only a nano level of this lipid layer. That's all. Simply, Tamil solla pona idu vandu oru koluppu. It is a fat. It's a fat containing virus. That's all. But you cannot see this virus in naked eye. So you can see this virus only under the scanning electron microscope or the transmission electron microscope. So that much very small, even below the nano level also. So it caused the disease called the Middle East Respiratory Syndrome and also acute respiratory syndrome, nothing but SARS. Already we have the medicine for the SARS. So it is coming under the same family, SARS family. So before that, you must know about what are the different symptoms of this COVID. So basically we can say it's a light fever, a dry cough. It is a most common symptom. You don't worry about somebody is having the fever or if you have the cough. It is not because of this COVID. Don't think negatively. Then coming to these common symptoms, that is a headache, a sore throat, diarrhea, again taste of smell, loss of the taste smell, then rashes, skin, discoloration of the fingers, etc. The serious symptom is nothing but difficulty in breathing, shortness of the breath, then chest pain or pressure or loss of speech or movement. If you have these type of the symptoms, immediately you have to seek this medical attention nearby the hospitals. So this is the basic symptom. So anybody is having now, don't get confused. If you have the fever or common cold, don't worry about it. But nowadays, if you have these type of the small symptoms, better don't take, that is, should not take any medicine from that your own medicine. You have to get this medical, seek the medical advice, that is medical advice from the concerned physician. Okay, so this is the basic introduction about this COVID virus. Then how it spread. So I need not explain more about this, how it spread. Already you watched the different type of the channels and nowadays you will get all the information. So basically this virus can usually spread only through the droplet. Suppose if a person is having this COVID infection or the coronavirus infection, if he or she sneeze, then immediately it will spread out. From the cold droplet, it will spread. So for that only, we have to avoid the personal contact. So here by the air, it's a dry cough by sneeze, then by the personal contact, it will spread. Then contaminated object and the mass gathering. That's why this is how the virus gets spread from one person to another person. That's why here all the countries are announced the lockdown. The main lockdown reason for the lockdown is to avoid the mass gathering. Suppose if we have the 15 people, if the 15 people, someone is having one or two may have this COVID or coronavirus. So unknowingly, he or she will spread the virus to other people. So that's why we are not allowing this mass gathering. So what is the prevention measure? So again, wash your hands frequently, wear the face mask, avoid the contact the sick people, always cover your cough or the sneeze. This is general prevention measures. If you follow these prevention measures, 95% of the transmission, coronavirus transmission from one person to another person, we can easily avoid it. Then again, I am saying how we are going to wash your hand by using the clean or disinfectant. So don't worry about any disinfectant. So disinfect nothing but, sir, I have to use only the Lifebuoy or I have to use the Dettol. Not like that. Already I told no, this coronavirus is the lipid. It is a fat. any simple soap solution. Suppose if you put a drop of the ordinary dishwash solution, Vim, then you have to rub your hand for 20 seconds. The virus will eliminate it from your hand. The last one is the stay home. When you are sick, you have to stick on. You have to stay in your home itself, and you have to get the medicinal care. Then don't mix with this people, even your own family. This is how the virus gets from one person to another person. Then how you get this health care? So again, you have to nowadays, now we are having the digital technology, and we have the home testing technology, and we have the telemedicine. Suppose if we don't move from one place to another place, we have to follow this type of the health care. What is the structure of, here I am showing one slide. This is the WHO, means World Health Organization. So they informing the people about this health risk posed by this coronavirus disease. Then how it spread from one person to another person. Here I am giving one structure, here one photograph. This is the cross section of a infected person lung. Inside you can see a small round blue color, no, that is your virus. How the virus, because this is the virus that can enter only to your lung, and it will spoil your entire lung. It will not move any other place. That's why if we have any sort, that is supposed to have any pain in the throat, you should drink some hot water. There is a warm hot water, mean not more than 40 degrees centigrade. If you drink the water 40 degrees centigrade continuously, if within half an hour gap, what happened? This virus, which suppose the virus is present in your trachea, then immediately it will enter inside your intestine. Then the virus, if we enter intestine, the virus will be killed, because in intestine the pH is acidic range. So the virus cannot withstand that type of the pH in your intestine. That's why the people or doctors or physician are saying better you have to drink only the hot water during this period. Already the temperature is very high now, no problem for Indian. Anyway, we will discuss in due course one by one. So this is the general structure of this infected lung. Inside this we can see the presence of this coronavirus, blue color virus. And this is general data I'm giving. So you suppose, if you think about this data, suppose in first one I have given the entire world scenario, then you can see how many people are affected, how many people are died. More than, now we are going to cross 3 lakh people are going to die. Already 2,92,000 people have been killed because of this corona. So coming this scenario to our Indian, so we have only the 47,480 active cases as on yesterday. And 24,385 people have been cured and discharged from the hospital. And the death ratio in India is only 2,415. So this is the data I obtained from our ICMR, Indian Council of Medical Research, where you should follow. The first data is the world data from the WHO. You see how actually this virus is a small virus that can cause only the influenza flu. You see, nothing but it's a flu virus. Only one thing is the precautionary measures. If you follow all the precautionary measures, what I explained in previous slide, then automatically you won't get any disease. The virus cannot enter in your body. So this is the data, because you must know how many people are killed because of this virus. This is that first one is this, that entire world scenario. Among this world, you know very well about this, what are the countries are more affected. So especially the countries, now the USA, the country, all the European continent, even the starting from the UK, European continent are severely affected because of this virus. Then coming to this Asian continent, and to the African continent and to the Asian continent, coming to the Asia means nothing but our India or Pakistan or Singapore or Malaysia, Thailand, China, Japan, like that. We are called as the Asian people. And when compared to these European and the Western countries, we are very, very less affected. So why we are less affected, we will discuss during the discussion period. So why the Asian peoples are not affected more with this COVID infection. Okay. And this is just your method. What are the things you have to do, precautionary measures? This is the one slide how I am giving in this automobile industry. So now, you know, when you are going to college, when you are going to an industry or going to any other places, then you have to take only the food and you have to take the water. But now, like you people like civil engineers or what are this while you are working in workplace, so you must take the hand sanitizer along with you. You should have the hand sanitizer and you should wear the mask, as well as here one man is having here is that infrared thermometer to check the temperature of this worker in the working place. So the first one is the precautionary measures. This is auto industry, not only in auto industry, you have to follow the same. The thermal screening of the employees, that is very, very, very important. Thermal screening of employees, conducting the body temperature check, maintain the physical distance at the showrooms, ensuring adequate stock of the sanitizers, regular do's and don'ts. Here the do's: observe good personal hygiene, practice frequent hand washing with soap. I already told no, we should not go for the Dettol soap or Lysol, whatever it is. Better, yes, an ordinary your bath or washing soap is more than enough to cure this, to remove the virus from your hand. So soap in running water, cover your mouth while sneezing and coughing. This is very, very, very important. So don't say I am not having the corona infection. I am not carrier. I am not that asymptomatic or symptomatic person. Don't think like that. If you sneeze or nowadays, now this is the scenario. No, this scenario. If you sneeze or cough, please you have to cover your mouth. Don't. If you suppose you cannot use the hanky, you can use some tissue paper. Just after that, you remove the tissue paper carefully in a dustbin. Instead of using the cloth, because each and every time we cannot throw out the cloth. No, you can use the tissue paper. You can cut the tissue paper into two. If you have the type of the feeling for cough or sneeze, just cover the mouth with this tissue paper, and after that you by left hand usually carefully dispose into the dustbin. And if you have continuous symptoms, if your symptoms are persisting continuously for more than 7 days or more than 5 days, this is that 7 days is that our WHO's norms, and our ICMR is also telling, in the government of Tamil Nadu is also telling, if you have the 7 days of continuous of infection, please you have to see the doctor. Don't take any personal medicine. Go on and buy a medicine, go on buy a self medicine from that medical shop. And I have the kind of cough for continuously cough for 3 days. They will give the azithromycin or give some erythromycin is antibiotic. That disease will definitely, it will subsidize for 1 or 2 days. Again, it will start after 10 to 11 days. Then condition become more severe. So that's why it is very, don't, again I'm telling you should not have any fear about this coronavirus. It is easily curable disease. You see the data. Every day in Tamil Nadu, you can see the news. More than 100 people are get treated from the hospital, and they are getting away from the hospital. This is do's. Coming to suppose what are the things we should not do in a workplace. Please, you should not have any close contact with anyone. Don't spit in the public place. Contact with live animal or consumption of raw or uncooked meat. So this is where our Indians are great. We are not eating any other raw or uncooked meat, uncooked non-vegetarian. So most of that's why I told no, the Asian people, why this coronavirus is not affected more on Asian people is mainly because our food culture. What are the food we are eating? So maximum, suppose if you take that food items, among that 100% of the food what we are eating, 97 or 95% of the food what we are eating is only the boiled food, only the heated food. If you take this type of the food, definitely we people are in safer side. But only one thing is, again, suppose if you follow the other norms, so we can eradicate this COVID within 3 to 4 months in our place. Then travel to farms or live animal markets. Anyway, we are not bothered about the last one, how we are going to travel. And how do you get the COVID-19? The first is a common man contact with this COVID-19. If the person is affected by that virus, someone infected, cough or sneeze directly, then if the droplet, little, you can see here, the little droplet is more than enough. That's why the WHO is telling, not WHO, don't forget the WHO, even our ICMR is telling a single infected person, suppose we have the corona infection, the single infected person can able to transmit the disease for more than 400. Just you think over. That is the problem we are facing. All that Western countries are facing this problem. Why it spread very fast? A single person, 1 is equal to 400. ஒரு person வந்து 400 persons they can easily, he or she can transmit that disease. That's why the mass gathering is not allowed. So how we are going to how we are going to overcome this problem, we'll discuss later. So here, after even you, suppose if I am not having the infection, if you're not having any infection, good, no problem. If you have the sneeze or if you have the cough, can sneeze it and cough it, no problem. After that, please immediately you don't use your hand to touch your eye or nose or mouth. After sneezing, you go to that our washroom, just wash your hand. More than enough. Don't bother with soap solution. If not problem, if soap solution is not there, no problem. You just wash the hand for more than 30 to 40 seconds. Then you can touch your eye or nose or mouth, because this virus can enter only through the eye or nose and mouth. Then it reaches your lungs. Inside the lungs, then automatically it happily leaves and it transmits the disease. Then what are the prevention? What you have to do? Some advice to the spread. One, you have to that is one is continue to practice everyday preventive actions as usual, regular. Keep the ill person in separate room for others in the household. Okay, ill person. Suppose if you assume that person is having the corona infection, of that your elderly people, in elderly people, the elderly people, no, you must be very cautious. You have to keep them in a separate room in the household. That if they are caring for the sick member in our household, suppose our grandfather or grandmother is, suppose they are more than 60 years old, now they are more vulnerable for this COVID infection. So you have to keep there in a separate room. Don't bother, but the food diet is the same diet, what you are eating we can give. Only one thing is you have to keep them very safe in a separate room, and you have to frequently monitor their health. If the person is having more than 60 or 65 years, that in our home, in your house or in your workplace, you have to keep the number 4. You have to keep the surfaces and disinfected, and also avoid sharing the personal item. Don't keep that. The personal item means hand key. Don't keep. Don't keep any your purse, or don't keep any your pen. If you keep the things, no problem. You can take it out and you have to rub with the sanitizer. Then, if you become the sick, stay in contact with others. Please, this is the most important. If you have the sick in the workplace, if you have the symptoms, or in a house, if you have the symptoms, you should not contact with others, even your own people, with their there is your father or mother or your wife or your children. If you want to contact them, please you have to contact with the phone or through the email. Then take care of the emotional health of your household members, including ourselves. Because nowadays because in our state, in our India, no problem. In suppose coming to these European countries or in USA and other more affected people, now apart from this corona infection, COVID infection, they have a lot of mental problem also. Psychologically, they are fully affected. You see, the doctors or nurses or healthcare people are seeing the dead body per day. They are disposing more than 1,500 in USA. You see, think over about the doctors. Think over about this frontline, that is a frontline warrior. What they think about that? Then that's why the mentally they are also affected. Even the family members. You know, what pathetic condition here in India also we are facing the problem. After the death, we are not allowing the people to bury. Again, I am telling this virus. Once this virus, the COVID persons are died, there scientifically it was proved that the virus cannot be transmitted from one that's a dead person to a live person. The virus cannot transmit it. Don't worry about these things. But we are not, some places we have some problem. We are not allowing to bury that dead person. Again, I'm telling, this is the virus. It cannot transmit from this unless otherwise if you touch the person. If you not touch, because after that what happened? They are covered the entire dead body with this PPE kit and other it's a plastic container, and after that they are spraying with this lot of sanitizers. Then what happened? The virus cannot be spread from one person to another person. Then here this is the more important. Nowadays, that problem in our Chennai, in Tamil Nadu already we are get to close this COVID infection. Up to only 2,000 or 3,000 only we have to count. But now the ratio is increasing. The main problem is the social distancing. In Chennai, is a social distancing, it is not possible. So we have to give the 1 meter difference from one person to another person. At least 1 meter means 3 feet between the yourself and other. Whether just to think over, you people what you are all listening my speech, please you think yourself first. Whether you are following this one, no. Only for 25 to 30% of the people, because what the people are saying, even if that our health department staff members are sharing some views, what they are saying, sir, for our people, the corona, it won't affect me. People are saying like this. The same people in Coimbatore is said like this. The corona, what is the corona? They won't affect us people. It's they have the good immune system. Now the Coimbatore is like our Wuhan. Now we closer to the Coimbatore. Because of the Coimbatore, now they are transmitted. Now the ratio you can see it's more than 5,000 to 6,000 because of this lack of this social distancing. Then what is the adult? Try to keep the adult. You should not contact your older adult, that is our grandfather or grandmother or some elderly people or some sick people. Better we have to keep them very, 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 very safe. Because if you take the data of this COVID patient after the death, the COVID death patients, if you have the data, the people are having the other complications. So apart from this COVID, the people died. No, they have other complications like diabetes and like the hypertension. They have the some other cancer and they have some dialysis problem. So these people are more vulnerable because the COVID, what the virus is doing inside our body, after enter to our body system, the virus nothing do anything. Simply it suppress our immune system. So our defense mechanism, what is defense mechanism? If anything enter into our body, so we have to act against the body. Simple example, if you take your home, if somebody is entered into your home, what happened? So immediately you will fight with the person and either you have to kill the person, then you succeed. If you are not able to kill the person will enter inside the house like that. This is the virus, coronavirus. If you have the good immune system, you will win. If you have the less immune system, definitely you will get the disease. That's why you have to maintain the social distance. Then how we follow the social distancing in this our construction site? In the civil engineering department, in construction site, I don't know how we are going to keep the social distance. But whether you know or whether you don't know, but we have to maintain and we have to follow the social distancing in the construction site. Here, emerging warning signs. Lips or face suddenly turning, that is a bluish, that is a persistent pressure in your chest, difficult in breathing, or confusion or inability to back up. This is the third one. Is the common one for we people. Suppose in the early morning, 6 o'clock, before that, if you have the college, it be 6 o'clock or 5:30 or 6 or 6:30, you have to wake up. But now since you are in lockdown, definitely you will wake up only in the somebody is and many of my students are sharing that, sir, every day we are skipping the breakfast. Then I said, please don't skip the breakfast. Then I asked her, why? Why you skip the breakfast? Sir, already it is lockdown. No. So usually I wake up from my bed only by the morning 8 or 9 or 9:30. But this is that before that we can do no problem. But this is that very dangerous period. We should not do or we should not skip the breakfast. So that we won't bother about this confusion or inability to wake up. Then difficult or trouble when breathing. Then how we are going to protect? Maintain social distancing. Keep the objects and surfaces clean. Don't, again, I told you, touches of nose or mouth and wash your hand very frequently.
Yes.
Then, coming to this public transport rules, this is the more very, very important. So whenever suppose you are going to purchase any item, please now you have to avoid the case. Because in Hyderabad, in Telangana, 15 days before, doctors again, the scientists, they found that this coronavirus transmitted through the this one, the rubies, or that is which one, the coin, it transmitted. So better you have to use only the card. Nowadays, all are using the Google Pay or Phone Pay or the Paytm like that. You have transfer the money. Then contact between the driver. That's why the government of Kerala now they have started to implement. So the suppose if the person is coming from the abroad or if was having the local transport system, what happened? The driver seat, no, behind the driver seat, it should cover with the only fiber, because the sitting person backside the passenger sitting, the person should not have any contact with the driver. You have to just cover with this white color fiber seat. Then next to the adjacent to the driver seat, we should not, only two people can travel in the car. So please, you should not contact with the driver, and the passenger must be kept to be the maximum. That's why yesterday also our government of India, then we started some trial. There are 15 trains now. That is like the Rajdhani Express. They have started from connecting this New Delhi to some of the capital, except the Chennai, because the Chennai up to, I think today we got some news that up to May 31st, there is no any train, that is a train transport in Tamil Nadu because of this COVID. The other state capital, no, little bit they have started to check whether we are going for the community transmission or not. And here, taxis and other vehicles, no, if you want to hire, better you have to use only that passenger per fare. Then cover yourself with the coughing and sanitizer, and try not to touching anything while you are going to travel. Suppose while you are going to use the public transport. Then personal equipments. Already told, when you nowadays we are going to classroom, we'll take only the water and the lunch box and the cell phone. But now you have to take your lab coat, that is your apron, whatever it is, surgical mask, you have to wear, no any other way. Suppose you are working inside this laboratory, suppose you have that in this inside the laboratory, no, we have more than 60 students are doing the practicals inside the lab. So sometimes it is not possible to maintain the social distance. So you have to cover the eye or face with the protection glass. You have to cover with the what we are using in our biological and microbiological laboratory, and we are using this type of the glasses. And you people also nowadays know any other way we have to use. And whenever, whether you have the laboratory or do know the don't laboratory, no problem. You have to wear the safety gloves. Use and throw gloves are available. Now it is available in the market. So whenever, because if you have the gloves wearing that system, then automatically there is no any transmission from one person to another person. Then this is the generally again you have to clean that frequently touch the surfaces and objects every of each and every half an hour. And this virus get the surfaces. Then you have to use some disinfectant. And what are that some of the items? I have given some example. Suppose if we have this sprayers, virus can withstand each and every 3 hours you have to wipe. Then if the cover every 4 hours, if it is a plastic, the virus can withstand for more than 2 to 3 days. And it is a cardboard, only 24 hours. It is steel, it is 2 to 3 days. If it is a wood, the virus can persist for more than 4 days. You see how it is a danger. That's why the cleaning of the surfaces is very, 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 very important. So again, I'm telling that the scientifically, they proved that the virus cannot transmit from that air. But if the person, the infected person sneezed, no, suppose if he is not covered her mouth, what happened? The droplet will come out, the virus will be there. Within these 3 to 4 feet, no, that virus can move in and around the place. If you cross the place without wearing the mask, then you will get affected. That's why you don't bother. Whether we have the infection or the mask, wearing the mask is not only for the infected person. Each and every person should wear the mask. Whether infected, no problem. Or not infected, no problem. We have to wear the mask. If we wear the mask, if we cross that place, then the virus cannot enter. So that's why this is the this is the places, sprayer, copper, the wire, how the virus can withstand. Plastic, it can withstand. In your wood, if you take the wood more than 4 days. So for that, immediately you have to each and every 1 hour time. No, otherwise, if a morning just spray with this disinfectant, then afternoon spray with disinfectant, and the evening spray that is a disinfectant. If you have that disinfectant, no problem. In 60 to 70% of this laboratory spirit or laboratory ethanol is more than enough to kill this virus. Just 60 to 70% of this virus is more than enough to kill this virus. You don't bother about this disinfectant. You can buy in our laboratory. We have the ethanol, or you can go and get the surgical spirit from that local medical stores or pharmaceutical companies. You dilute to convert into 60 to 70%, and now you can use this one as a disinfectant. And this is the way now each and everywhere we have started to do. Everyday habit now, instead of going to college now, even for now the class, I am taking this seminar only through this webinar. So like that, this is the practice. It's now, again I am telling, we have to live with this virus for more than 2 to 3 years. We used it because this virus can withstand in our body. It can be, because now we can see in the US how many years it will take to cure the entire people. Then after that, they have to come to normalcy. I don't know what happened. So you have to live with this virus. Then how it live? No problem. The virus must be there. No problem. Then there is no any problem. So now that's why the more companies will allow the employees to work remotely. For the other companies, it is okay. For teaching community, it is okay. For other laboratory companies are okay. But coming to the civil or coming to the mechanical, what happened? Whether remote, we cannot control remote to construct the building from home itself. Though we have to go to our site and we have to start the work. So that you have to follow the norms. If we follow the norms, definitely 90 to 95% of the problem we can overcome. Now, this I told you, no, the mentally many children or mentally many people are affected because of this COVID. Because of this COVID virus, many people are affected. Then this is the method I told you, no, 60% alcohol is more than enough, and rub inside the finger and palm to palm, then finally fingernails. Then only the virus will remove. Simply after adding, just to say, after rubbing, before 20 seconds, if we wash the hands, the virus will not remove. So this is the procedure. Please, you have to follow very carefully. If you keep your hand very neat and clean every day, so you are not susceptible to this corona infection. So 90% of the problem will be solved. That's why even the government of India, even our Prime Minister, even our Health Minister, our Chief Minister, or everybody, even our Department of Health, ICMR, the scientists, ICMR Secretary, each and every people are telling that please wash your hand frequently. Wash your hands frequently. If you do this, it is our, hereafter it should be our routine. So coming to the construction side, what happens? So you have to keep 2 to 3 buckets, separate places. Ask that employee, ask that civil workers to wash their hand. No, any other, because we should, otherwise, no, you have to, again, you have to live with this virus, coronavirus. And this is the method, what we have to do in our part. Then coming to this infection data. Yes, this is our part. Then coming to this civil engineering project, it's not my data. The universal data is telling that the project started civil engineering fell by 30%, 34% in April compared to the same period of the last year, according to the new figures released by one construction company analyst. They are saying that 30% of this construction project will be fell down in this April. Then here I am giving another one, the private housing project. It's a decline of the 43% when the same data of this previous year. When compared with this April and May 2019, April and May 2020, so we are in fall down of the 43%. Then recently, we entirely, you know that already you people are read the news in that channel or some other newspaper, it came, all that constructed materials, no? Then this one, that stones or that soil or steel or cement, whatever it is, the rate is there, they increased by 20%. Because to overcome this shortage, then how we are going to adjust? Then it will take a minimum to fill this lacuna, to fill this hole. So we have to work hard for more than 2 years. So lockdown for 2 months, and we got to work to overcome this type of this failure to overcome for work for more than 1 year. And what are the attractive opportunities in this construction market? The construction companies finding ways to keep the project going in the assignment of this COVID-19 outbreak. In 2019, estimated cost is $7.58 billion US dollar. In 2024, they are estimated for that is $16.8 billion. And whether it's a projected score only, I'm giving it's a US dollar projected score only I'm giving. Then because I don't know what happened after this COVID outbreak, So whether the $16.8 billion is decreasing or $16.8 billion is increasing, I don't know. Again, it's based upon the viral infection and how it persists in the globe, how it affects the people. And coming to this non-residential projects, again, we have to go for the basis. Against the year, again, 21% and 31% it is falling. Coming to the industrial project, declining by dropping by 42% of the year and 31% of the year. Seasonally, then we have to change. Then private housing project, again, it's fell down for 43 because these 3 months, there is no any single construction. Okay. After the lockdown is getting over, then again, it is a very tough job for the civil engineers to assemble that, to get back all the employees. Okay. If you get back the employees, no problem. Then, what is the cost? Already construction material cost is increased. Then you have to increase the daily wages of the civil workers or employees. Then that's why my advice as per microbiologist, my advice is better if you have any construction, if you start any construction work in suppose if the place near the Coimbatore or near Saranambatti or near Madhukari, whatever it is, please try to put the houses for the construction workers. They have to stay the construction place itself. Don't allow them to move from that place to some other place. If you have this type of that place, if you have this type of the techniques, somebody, if you have construction, suppose if I am constructing house here, then I have to keep some other place for the people staying. The people are staying in and around the place, that there will not be any problem for this COVID infection. That's why the social distancing is, we are maintaining the social distance. If we keep the people workers, civil workers in our place itself, then 30 to 50% of the problem will be solved. This is the guidelines, job guidelines, COVID-19 construction. When you have to follow these job guidelines. One is, if you feel sick, please, if you already, whenever the people's, the employees, the workers, civil workers are coming to the site, you take the thermometer, it is maybe around 3,000 rupees only, 3,000 to 4,000 only. You just check the temperature, body temperature. If it is 99, 98, no problem. You can allow them to work. More than 98 or 99, please ask them to take some medical advice. So check the first entry itself, you have to check the temperature. What they are doing in the airport, what you are doing in the railway station. Even the government is planning to conduct the frequent temperature checking in the bus stand itself. Okay, wear the mask in all times while in the workplace. Here, another big question will come. The mask is made up of the cloth. Since we know we are civil workers, civil in the construction place, what happened? There is the big chance for the dust. So each and every half an hour, we cannot remove the mask and we cannot give a new mask to the workers. So for that, after the wearing, before wearing the mask, or instead of that, better you have to cover these things with some other plastic seal. Then automatically the dust will not be coming. Then maintain 6 feet social distance in the work duties. So this is the very, 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 very most important, whether in working place, civil working place, whether it is possible to do this 6 feet work. Suppose if you wear this type of the mask, if you take this type of this element, that is a 3D sealed, no problem. Then practice, you have to, before every day morning 9 o'clock, they are coming for the work. Please, the site supervisor, please, you must be very careful. 10 to 15 minutes you have to allocate, and you have to give a thorough instruction to the civil works, what are the things they have to do. So they are, before that, after assembly, the civil site supervisor should please carefully tell the employee, tell the workers, wash your hand, then just give the disinfectant, rub them, rub their hand. You got check frequently, ask them to wear the gloves. If it is rubber gloves, no problem. If you have rubber gloves and all, then you can easily, it is easy for you people to wash with soap solution. Then practice the good hygiene, the clean and the disinfectant all that sad areas, and the equipment. What are the equipment you are routinely you are using? What are the equipments you are different type of the equipments you are using for the construction site? You can, nowadays there is another workload is increasing for the people. You have to allocate another one person separately. After that work, after the 5 o'clock or the 6 o'clock, the man, he has to wash and clean all the equipments, constructed equipments very carefully. and you have to keep them very safe. You have to keep them very safe. Then if you follow contact, whether you have to follow no other way, then only we can succeed the infection. And this is that multiple end-to-end consideration. Here the tier 1 supplier, tier 2 supplier coming to the plant, distribution center, customer, and customer to the customer. And this is the how we are going to work. 2-tier and 3-tier work. How we are going to remove that COVID infection problem among these workers or among these employees. And according to the Civil Engineering Contract Association, here are the steps that construction companies should do during the COVID-19 crisis. So one is, please be careful increasing the welfare and hygiene facilities and protecting workplace. Reviewing the construction arrangements to understand that options now, in and future. Contacting our government and authorities to discuss the arrangements for delaying payment of the taxes. Then again, setting up the project and specific communication network. Reviewing your programs regularly, protecting the business critical functions, and reducing the contact between your leadership team. And maximum, you have to avoid to go for the overseas travel to conference or call or any other meeting. Better you have to conduct only the online meetings. That's why I told no. Better you have to give the place for your civil workers in the construction site itself. If you give the place for these people, civil workers in your constructed site itself, I told 50 to 70% of the problem will be solved. Number one, what is the problem? Movement, that is a transport, no problem. That movement will be restricted. That contact with other people, social distancing we are maintaining. Then automatically for 50 to 60% of the problem will be solved. Then workers are still commuting the busy building site despite the government crackdown or the social distancing, no problem. Then there is no any other viable option to keep the workers safe. They have done with this your hope and that other thing. We have to very careful while doing this, while you are practicing these things in the construction sphere. So we have to clarify, because it is in our hand to clarify all these things to our workers. That here I told what you have to do. Generally in construction places, you have to give the screen all employees, maintain this record. Suppose if the person today morning, the 5 men and the 3 women are coming, you write the name and check the temperature. Entry time 9 o'clock, you write the temperature 9 o'clock, they have 97.2. And check in the afternoon, after lunch, 1 o'clock, the temperature 97.6. While going back or 5 o'clock, what is the temperature? You have to maintain the record. This is the way we have to follow hereafter. Then have everyone check it, everyone wear the mask and gloves. Otherwise, we have to provide. As engineers, we have to provide the mask and gloves to our employees, because the employees, our employees, we have to safeguard our own employees. Then keep the temperature logbook. I told you, you have to maintain the logbook and secure the 6-foot markers at the workstation. Clean all the areas in your site. And this is that all the contractors should be maintained. But providing PPE kit, it is not at all possible for our construction. Instead of that, we can give some other, which one? No, keeping these employees with some other hazard under the risk assessment. No problem. And this is the same thing. And this is the desktop where we have to use, now we are going to use only this transfer mechanism. No? So again, I'm not last, before that I conclude, I would like to share only one view. Then maintaining this, everyone is saying maintaining the social distance. Yes, social distance maintaining is very, very important. Okay. Now, because of the COVID, so many of my friends are, because I am staying in that remote area. My workplace is, my institute is near that, some of the near village. It maybe we can say, I cannot see a human being in and around my area. For me, I am in safer side. So I am maintaining the social distance. No problem. So coming to these people who are living in some other place. Why then Mumbai, the COVID infection is increasing? Because of they are not having ability. Because there is no any place. Social distancing is not possible in their place. Coming to the Coimbatore, the social distance is not possible. Coming to Chennai itself, Rayapuram and the Kodapakam area is heavily infected because of the no social distancing. That's why we are worried about that this virus should not spread into the villages. That's why our government took a lot of effort. Now 50 to 70, 80, we can say 80 to 90% our villages are now we are safe. You think over inside the city itself, it is not at all possible to control the infection. The virus entered in the village, what happened? Because in the village side, the other village side and other area, the maintaining the social distance is not at all possible. So as per my view, what happened? Those who are living in the apartment, I think they may think over. Because nowadays they felt very bad.
Somebody talking to screen.
So further day, how they are maintaining social distance. So now what happened to the civil engineers? What happened to civil work? Whether we are going to construct the 15-house apartment or 20-house apartment, I don't know. Or you want to construct separate villas or separate house to maintain the social distance, like our US and the UK people, they have this type of the houses. Even though they have this type of the houses, the infection ratio is very, very, very high. So these are the things we have to, the people, that definitely it will change the mindset of the people. Definitely it will change the mindset of the people after this lockdown, after the COVID infection fear is getting down. The people are think over whether they have to live in that apartment or we have to live in the colony house or we have to switch over into the separate house, because this virus created this type of the problem, this type of the fearness among the people. And here again, what is that remedial measures? How we are going to keep our body health? This is only a tip I am telling. Anyway, every day, even in WhatsApp or even in that newspaper or even in that government of Tamil Nadu, government of India is telling, one department is called the Ayush. Ayurveda, Unani, Siddha, and this homeopathy medicine department, it's coming out of a separate department called the Ayush. So there, the Ayush is giving different type of that tip to maintain or to increase the immune system. If the workers, we people have the good immune system, no problem. How can you improve the immune system? What again I'm telling, our food practice. So already our Indian food practice, already we are using the all type of the ingredients. What the Ayush is telling, we are using. Try to have some other, try to drink more water, try to drink more warm water. Each and every half an hour, you drink a cup of water. If the body becomes sweating, no problem. You won't get any disease. If you have the virus will enter inside the stomach, no problem. So like that, you have to increase your immune system by taking the different type of this green vegetables. And even if you take the egg, no problem. If you take the green vegetables, no problem. You have to increase your great immune system, then automatically that virus infection ratio will reduce to 40 to 50%. If you have a good immune system, definitely the virus will not enter in our body. So how we get good immune system? By taking the good immune system, that is a food. So for that, you have to visit that our Ayush website, Ministry of Health website. You have to visit the website. There they are given that morning what are the things you have to drink, afternoon what are the food you have to take, that before that is what supper or dinner what are the food you are going to eat, then after that what are the things. Then better every day in the night, if you like or don't like, you take a cup of milk, add a pinch of that pepper, you drink along with this pepper, that is more than enough. Then pepper and the ginger tea. We are taking the tea, just add the ginger, add a pinch of cardamom. Then you can try to drink. You have to come routine life. Nowadays, instead of taking the ordinary tea, just add a pinch of ginger. Suppose in the evening time, if you want to drink tea, no problem. Don't add any milk. You boil the water, 1 cup of water, add a teaspoon of your little teaspoon of your tea powder. Just boil it. Yeah, add 1 or 2 drop of the lemon. That matter over. Just drink as a lemon tea. If you have any humidifier in our home, every day try to have some of that humidifier. No, you have to take this humid for more than 10 to 15 seconds or in the evening after 4 o'clock. Or suppose if you are coming out, suppose you are going out for that work, coming back to the home, after that you gargle with the ordinary water, hot water, warm water. Then you have to make some humidification for 5 to 10 minutes. That is more than enough. Because why I am telling, if you have this virus in your face or if you have the virus in your nose, if you have the virus, because the virus will attach only eye, nose and the mouth, it will enter inside the intestine automatically. The virus will be destroyed. So these are the some clinical tips. That's why I'm telling you, our Indian already we practiced to take these type of the traditional food in our routine life. Knowingly or unknowingly, our forefathers were taught a lot. They are great because most of the food what we are eating only the boiled food, fully cooked, not boiled. We can say fully cooked food. Then after that, in each and every time we are using this food with this garlic we are using, and we are using turmeric, we are using ginger, we are using lemon, we are using. These are the items, 4 important ingredients or enemies to the virus. So please, one, try to change your food habit. Then two, try to change your social distance. And these are the things if you follow, automatically you should keep away from the virus. So now, I'm going to conclude my session. If anybody is having any queries, please you can ask me. No problem.
So this is Dr.
Hello?
Kanmani. Thank you, sir.
Hello.
Yeah, is it audible, sir? Kanmani here. Hello,
Yes, madam.
sir. Is this audible?
Yes,
Thank
madam.
you, sir.
Yeah.
Thank you, sir. Thank you so much for your wonderful presentation.
Yes, madam. Thank
And
you.
we have received certain feedbacks.
Yes,
as
madam.
Very informative and very right time, right presentation and all. We are receiving so many comments in the chat box in YouTube
Okay.
as well as in Google Meet, sir.
Okay,
So
madam.
I handed over the session to participants.
Ah.
If you are having any queries, please ask.
Yes, ma'am. Please welcome. Participants, if you have any queries, please you can ask. Hello?
So I request the participants, if you're having any queries, please ask. Or else you can chat in the chat box. So many of the participants are saying the session is very useful and informative.
Okay, madam. Thank you, madam. And also the participants should thank the department organizer. This is the right time they are organizing this because this is the first time, no, that COVID infection. How we are going to maintain this type of that awareness program for the civil worker. I think this is the first time, no. I am also heard about this is the first time we have this type of the discussion. Anyway, it's a good appreciation from my side to the department people for organizing this type of the seminar. For the civil department separately, because other places and all each and everyone knows, because civil maintaining that social distance, maintaining the hygiene in the civil working place is very, very, very tough. So at least 1 or 2% I think it may reach the people and they will pass the information to the other civil people. So again, I have to thank the department and as well as the college principal and the management for giving this opportunity to share my views to that.
Good afternoon, Professor. A small question.
Yes, sir.
Sir, yesterday actually we are watching about the Ayush website and other things. My daughter was with me.
Yes,
She's
sir.
doing her +1, +2.
Okay.
She was so innocent. He was asking her, putting the question that
Yes, sir.
you are told that if you have turmeric, ginger, everything, if you can fight against virus.
Yes, not fight, sir. It can increase the immune system of our body.
Okay, so all the things known to us.
Yes.
Still, why then no? Why not a suitable medicine is not been or medicine is not been developed?
Yeah, that's why I think very good question. That's why that is today one virology department head because from USA, because one of my classmate we did MSc together. Now he is working as the professor of microbiology in Trichy University, but now he is at USA. And my friend, and every day we are chatting and we are discussing about what are the medicine we are going to discover like that. the virology department head in USA, what he is saying that if you are not going to discover the vaccine, if you are going to discover any medicine against this coronavirus, the future will be a big problem. That's why I am telling that virus is at first class. It's a first slide itself. I told very clearly. This virus is having different structure. No, in each and every places it having different type of the structure. Anyway, it is under process already. That UK they have started, Italy they have started, even China started. Even 2 days before, our Prime Minister of India also said that our ICE team is also started to work to find out the medicine for this corona. So instead of that, along with this one, these type of the traditional or Indian traditional food system is having to increase the immune system. If you have the good immune system, definitely the virus will not enter. So anyway, it is under process to develop this medicine against this virus. Under process, it will take another 6 to 7 months.
Hello, sir. I am a fitness from S Engineering College, sir.
Okay.
Sir, basically I am an electronic engineering student, but I love photonics, sir.
Okay, photonics.
Yeah, yes, sir. By using UVC light or infrared light therapy, we can control this virus, sir.
Yeah, UV we are using in our laboratory itself. Ultraviolet rays we are using in our lab itself. But it can the one problem using we should not expose the UV light directly to the human being.
Yes, sir.
Because if we expose the UV light to human being, what happens? Our cells get mutated. So
yes,
it is
skin
not
cancer.
possible. It is not possible to use this UV radiation. But you can sterilize the workplace. If before, suppose in the room itself, you have in the room, no, just to switch on the UV light for 10 to 15 minutes, switch off that UV lamp, then you can enter and you can work. It is in safer side. But it is not at all advisable to pass the UV rays to the body directly. You should not use.
And sir, the sanitizer method, if you use in gas mode or liquid mode, which is most better, sir?
Only that humidifier, gas method, gas.
Oh, okay, sir. Thank you.
Thank you.
Any other queries? Sir, one of the participant he is asking, when you go for the work after lockdown, what are the precautions we should take before entering the site? The main foremost precautions they are asking.
Only one thing, foremost precaution is should wear the mask. They should wear the mask. If it is possible, try to wear the gloves. It is more than enough, and ask them to wash the hand frequently. Better, they have to take that disinfectant with them. Each and before you are taking the tea, just wash your hand, disinfect with your hand, and these two things are very important. Wearing the mask and maintaining the social distance. This is two things we have to. Whether you like or don't like, but no other way. Maintain the social distance at least of 3 feet, as well as that mask is very important. Gloves under no problem. Mask and the social distance is we have to take 150% of that safety precautions you should take after lockdown if you go for the employment.
There is one question.
Yes, sir.
Another question. Sir, another question.
Can we reuse homemade mask again after washing? Hello, sir. I have a small question.
Yes, sir. Please ask me.
Can we use homemade mask
Yes.
again after washing?
Yes, sir. Homemade mask we can use, no problem. But washing means after washing you have to dry under the sunlight.
Okay.
At least if you use the homemade mask, we can use. You have to change the mask after 2 days. Okay, after 2 days you have to wash, and under the sunlight you have to dry it. Before that you can use another mask. So you have to change the mask for 2 days once, 2 days once. Wash it and wash it, use, but only for 3 to 4 times only. Again you have to go for the new mask. You can use, no problem.
Hello.
Okay. Thank
Yes,
you.
madam. Thank you.
Sir, I mean, Akshi, the one of the participant asked the question, sir. Is
Yes,
the
ma'am.
available N95 mask be reused? Can N95 and V44 mask be washed and reused?
No. Yeah. N95 mask and another V94 mask, we should not wash it because yes, how to wear the N95 mask, they have written in that mask box itself. Please, you should read very carefully. The N95 mask வந்து நீங்க வாஷ் பண்ண கூடாது. You should dry the mask under the shadow. ஒரு நிழல்ல தான் நீங்க ட்ரை பண்ணணும். ஒரு 2 to 3 days, ஒரு 3 அப்ப 2 மாஸ்க் வேணும். அது நிழல்ல வந்து 2 days விட்டுட்டு again you have to use for more than 6 months வரைக்கும் யூஸ் 2 months வரைக்கும் யூஸ் பண்ணலாம். பட் அதை வாஷ் பண்ண கூடாது. N95 mask வந்து it is, we should not wash it. How to use the N95 mask? The constructs that is that people know that the manufacturer itself, they have given that sheet.
Sir, another question the participant asked, sir. Is homemade mask useful to prevent the virus, sir?
வைரஸ் prevent homemade mask யூஸ் பண்ணலாம். வைரஸ் வந்து நம்ம கிட்ட இருந்து அடுத்தவங்களுக்கு ஸ்ப்ரெட் பண்ணாது, அடுத்தவங்க நமக்கு வராது. We cannot, but you can again one participant asked, no, if you use the homemade mask you can use, no problem, but you have to wash. Suppose first today I am using, after entering home remove the mask carefully, keep it in the soap solution. For soak it the soap solution, then wash it, dry it. The next day I can use another mask. Like that you have to change it. Only for 3 days you can use the 3 to 4 days you can use the homemade mask. But you should wash the homemade mask after entering the home with using the soap solution.
Sir, I have one more question.
Yes, sir. Hello.
I have one more question, sir.
Yes. Please ask me.
How we can disinfect the answer sheets before taking examination in any institution?
Please again, pardon.
How can we disinfect the answer sheets before taking examination in our institution?
Disinfectant of what?
Papers.
Answer sheets.
Papers. Answer sheet.
Yeah.
Yeah, okay. If you disinfectant of the answer sheet fully, it is not possible. Suppose if you have that setup, you can make a small chamber, glass chamber. Inside the glass chamber, you can fit a small UV lamp. You keep the paper inside the UV lamp, close the chamber perfectly, switch on the UV lamp for 10 to 15 minutes, then switch off that UV lamp, take out the paper. Before that, you have to wash your hand, you have to evaluate the paper. While evaluating the paper, be cautious, don't touch your mouth or your nose or your face. Before, suppose if you want to touch your mouth, you can wash your hand with the disinfectant, then again you have to go for that paper valuation. If you do this routinely, then no problem for this getting infections from the paper answer sheet.
Sir, another question.
Yes, madam.
What are all the possibilities to get affected when travel in public transport, and what are the safety measures have to take?
Yeah, while going for good question. While going for the public transport system by a person A or B, please, number one, precautionary measures before entering inside the bus or before entering inside the cab or train or the air, wear the mask. You should wear the mask. And if you're going by the train or if you're going by the air, wear the gloves. If our transport, our bus and all, no problem. If you enter, no, if don't touch any other unwanted place. If you want to touch it, you can touch, no problem. After touching, no, if you're coming, get down from the bus or get down from the air or other things, again you have to wash your hand with the disinfectant. Without using any disinfectant, please, you should not touch any other part of your body. So maintain the social distance while you're using this. Already you don't bother about anything because the government itself, they are designing, because if you yesterday they made the small trial, no, the train travel, then the train travel, they are not giving any blanket. We have to bring our own blanket. They maintain social distance. You take the public transport system. Suppose if the place is for the 50 passenger, they are allowing for 25 passenger. So social distance, no problem, but we should wear the mask, maintain social distance, and wash your hand frequently with the 60% of alcohol sanitizer.
Sir, and another question from the participant.
Mm.
As we are a teacher, when
Mm.
students return back to the classes,
Mm.
what precautions to be adopted?
Mm.
And another thing, you are telling about a social distancing.
Mm.
So
Mm.
inside the classroom, the
Mm.
students per bench, they used to sit around 2 members.
Mm.
But what kind of social distancing we have to do?
Yes, it's another problem. I am also thinking the same. Suppose if you take the class more than 60 students, before that we can accommodate the 60 students in a class, but now we have to construct more classroom, 30 plus 30. We can allow them to sit only 30 students in the bench, and don't you can maintain the distance of 3 feet. Then you have to allow the student to sit inside that, keep the distance of this one students, another students, the gap between the students should be a minimum of the 6 feet. You have to maintain.
And another question, sir. Whether virus spread by clothes when went outside and came, that is returned back to the home. So
Suppose,
what is the thing?
yeah. Suppose if I am going out, if I am contacted with this any other infected people, suppose in unknowingly or unknowingly, I am crossing one place, I am crossing the place, somebody is sneezing. The sneezed man or the woman is not wear the mask. What happened? The sneezed droplet may also attach to my cloth. So nowadays, after entering your home, you are coming from the workplace, after entering in the home, that's why our culture, Indian culture, what happened? Every time you are coming out from the home, we are washing our leg. After washing your leg and after washing your hand, please go to your bathroom directly, then remove your all that cloths and put it in this soap solution, take a bath, then you can use, you can come back to your home. Yes, it is mandatory to keep your used cloth. Every day you have to change your cloth. We are going out and entering inside the home. It is mandatory. It is only for certain period. After that spike, no, that infection spike will reduce it. Then we should think about other remedy measures. But at present, it is in a peak time. No, already told, no, at least 1 year we have to practice and we have to live with this virus. We know other way. We have to live with this virus. Virus and the mice ourselves become in the future. What happened? They become our good friends. No problem.
Sir, another one student, I think so. She is staying in the hostel, it seems. So after lockdown, when she entered into the college, especially into the hostel, the precautions to be adopted her is what?
She should not bother about any precautionary measures because the management and that our hostel warden itself, they take all the precautionary measures, because after the lockdown gets over, I think the colleges will reopen for that August 1st. No, yeah, maybe before that we have to keep. That's why in the before that, take a room in the hostel, they may accommodate more than 3 or 4 students. But now the government, I think they will give some. We are waiting for that. That is instruction from our high officials. After getting that, how we are going to maintain the social distance in the hostel, I think they may allow to stay only 2 or 3 based upon the room size.
Sir, another question. Is virus spreading by dust, sanitizer, or any detergents can be used as the part of the precautions?
Yes, ma'am. Any sanitizer, any soap solution we can use. But soap solution we cannot spray on our body, no? Sanitizer, after using the sanitizer or any soap solution, it can eradicate the virus.
Sir, if any virus affected person, he was in the work, And another thing, he left to the home.
Uh,
Right? The
uh,
virus affected person, that is COVID-19 positive case.
uh,
When he gone out from the college,
uh.
within within how much time we have to spray the sanitizer, because he may around the office section all over.
After, as soon as you get the information, you should
No, tell
make.
how long time the virus will be there.
That's why based upon the place, I told you no in the class itself. Based upon
Yes,
the place, yeah. Based
cardboard,
upon the based upon the place, the virus will persist. But inside that, but there's so far the virus it is not transmitted through air. No, we don't have any scientific support whether the virus airborne diseases. There is no any scientific support. If you feel that, then better you can spray with the disinfectant. Automatically, the virus will be destroyed.
Sir, in village side, they are using like neem along with turmeric and
Turmeric, yes.
salt, crystal salt. All they are
Yes,
utilizing.
yes.
Are you supporting that?
Till now, we don't have any scientific report, but basically, this neem is antiviral. Neem is containing some antiviral property. Turmeric and the salt, these are having the convert this pH. And if the virus is there, no, automatically it may destroy. But till now, we don't have any scientific support. No one has proved scientifically, but traditionally we can see this neem is having some of the antiviral agents. So better if we have that system, we can follow any other side effect. We can follow this method, no problem.
How long the virus present in the atmosphere, sir?
And that's why I told no the slide. Now I am showing some slide. You can see the sprayer, copper, plastic, cardboard, steel, or wood. So this is the time that virus can persist.
No, sir, the atmosphere.
In the air, you are asking. In the air, you are
Air,
asking.
yeah, air.
In the air, for that, that's why I told so till now we don't have any scientific support whether the virus is airborne transmitted or not.
So one of the participant, she is asking like if whether it is possible to spread on the hair,
No.
human hair.
Human hair.
Yeah.
If the person, if I am infected, the definitely my hair outside, not inside, the outside of the hair may containing this virus. That's why we closed in all the shop we opened except the saloon, except the spa, except the gym. We closed it. No. If you wear that hair cap, no any other problem. It may there is a chance to transmit through the hair while going for the spa or that beauty parlor like that. That's why it's closed now.
Whether the sunlight will kill that virus, sir?
No, it will not kill the sunlight. Will not kill the virus. We can suppose if we stand under the sunlight for more than 10 to 15 minutes, you can increase your vitamin D. If the body will get more vitamin D, what happens? Automatically, your immune system is also very high. But scientific, no any other report.
At what temperature it can be removed? One of the participant is asking.
No, that study is under process. The temperature, which temperature the virus will be destroyed until it's under process. Not yet we received the report. So far, we don't have any other report which temperature is favorable or which because you see the virus, no, the growth. Is the virus can grow 0 degree. Even the way in US the temperature is 4 or 5, the virus growing very well. Even in India the temperature is 41, the virus is growing very well. So for that the studies are going on. But that's why that medicine what we are going to invent for vaccine or the medicine, we have to be cautious. We have to take these all the parameters before we are going to invent that vaccine or medicine.
Okay, sir. Thank you so much, sir.
Thank you, madam.
Thank you so much for your valuable time spending with us.
Okay.
That too with a very recent and informative presentation, interactive. It's very much good.
Okay, madam. Thank you all. Again, I wish you all the best and be safe and stay very, very safe. All the best.
Thank you, sir. Thank you so much.
Thank you.
Thank you,
Thank
sir.
you. Thank you. Thank you.
afternoon, sir.
Sujita ma'am, shall we wind up?
Yes, ma'am.
Yeah.
ஒரு நல்ல ஓட்டாக்டான்னு சொல்லிக்கலாம்